because I think, like most of my constituents, you probably went online trying to shop to find what was the cheapest airline ticket to come into town, so I definitely appreciate you being here. You know, unlike buying groceries or shopping for Christmas gifts on sale, Americans simply do not have a reliable way to know how much equivalent services or costs are from different providers. Now, President Trump has emphasized the need to move away from government-sponsored subsidies going straight to you, the insurance companies, but rather directly in the hands of working Americans. Now, this common sense approach would allow Americans to take control of their health care in a free market way that our country is founded upon. However, now that requires clear transparency in different prices offered by doctors down the street versus the one across town. Now, this is something that I'd like to get into, and Mr. Joyner, my team will be following up with you in some written comments on that. But given the time, and just to put you on the docket, Mrs. Boudreau, we are going to have, my next question is going to be to you about how you support patients and their doctors making their own personal medical choices, but I'll be coming back. First of all, back in March of this year, this is going to be a yes-no answer, so you won't really have to think about it, but just think about the body in which I'm going to be answering this. I introduced the CARE Act with Mr. Doggett, a Democrat also on this committee. This legislation would require the Center of Medicare and Medicaid Innovation to reestablish a pilot program to test an alternative payment model for healthcare services provided by our ground ambulance. While this bill would only apply to Medicare beneficiaries, treatment in place models, which provide payment to emergency medical technicians, paramedics for treating patients on the scene, avoiding that costly, unnecessary emergency room visit that are available nationwide. Now, I'll go down the dais, as I said before, but could each of the witnesses here answer with a simple, not you, Ms. Young, but I appreciate, I mean, if you want to say yes, you can, but if you wanted to go through just yes or no, whether you believe that allowing people who call 911 to be treated where they are, when medically appropriate, instead of requiring ambulance to transport them to an emergency room that would reduce healthcare costs and coverage costs. I'll start with you, Mr. Hemsley.
When medically appropriate, yes.
Yes.
Yes, we support it.
Yes, we support it.
Yes.
You like data? Okay, that's good.
Yes.
But at any rate, listen, I hear from constituents every day, as you've probably heard, and I know you were in the lesser committee before you came to this committee, but whether healthcare provider or patient, but the denials for care. So, Mrs. Boudreau, what practices related to the utilization of management, but included but not limited to clinical guidelines prior to authorization and preferred formularies has your company applied to improve the coordination of offering services and treatments with providers and patients to make sure that the patients you insure receive the access to the services that they are seeking?
Thank you for the question. I think it's an important one, and let me start with we support the clinical decisions made by the treating provider. As it relates to prior authorization and other things, we are about less than 3% right now go through prior authorization, and as we said, the most of them are approved. I think it's still important, though, because as medical treatment continues to evolve, we actually see this as a partnership with patients and providers. Partnership that allows them to use medical evidence, also look at the appropriate site of care, drive affordability, and we think it's a very important part of that. And we've been making very significant investments. I think one of the things that we can do in this process is share data directly in an interoperable way with care providers so we can be real time. And we've been doing that, and what we found is that with that data we can make faster decisions and we can support patients better. And that's an opportunity, as I shared in my opening testimony, about using AI, not for decisions, but for getting the data in the hands of both of ourselves and the care providers to make better decisions. And we think that drives both affordability, but also drives easier access for patients and consumers.
I am at my 5-minute mark. I want to thank all of you for being here. My team will be reaching out to all of you with additional questions, and with that, Mr. Chairman, I yield back.
Mr. Yakum.
Thank you, Chairman Smith. U.S. healthcare spending exceeds